Yeah, I'm going to tell you the story of Kritika today. You know, Pulmonary Hypertension Day, World Pulmonary Hypertension Day or PH Day is coming by. And it's just important to remember how critical our patients have been at some stage and how medicines have really helped. So the focus of this discussion is how medicines can change or improve the quality of life of a patient. We don't have medicines yet to improve the lifespan of a patient, but quality can dramatically change. Kritika is one such patient. She came to me. She was in not good shape at all. Her belly was swollen, her liver was big, her heart was failing, the right heart function was down, her oxygen level was very blue, her eyes were puffed up, her face was swollen, and I really did not give a very encouraging picture to the family. This was exactly 2.5 years back. At that time, we started a bunch of medicines. We did not admit her in the hospital. We started a bunch of medicines and we gave her medicines and followed her on a regular basis, on a daily basis, and we figured out which medicines will work on her initially to get her out of this state of serious heart condition and heart failure that she's landed up in because of pulmonary hypertension. Once we improved the swelling over the body, then we started working on pulmonary hypertension. We gave her an oxygen concentrator. They used an oxygen concentrator so that her general state improves with some oxygen availability. Number one. Number two, we decreased the swelling on her body that improved her movement and her ability to actually digest the medicines and absorb them. And finally, we started giving her medicines which lower the pulmonary pressures or lung pressures. With those medicines, always we tell parents that it's going to be 3 months before we see a change. And we gradually started seeing a change where she started walking. She first started standing. Imagine, she had come to us when she was about 2.5 years old. She started standing because her body could not even take at that low oxygen level, the standing part of it. Then she started walking. A little playful she is now, but she's able to continue all of this without oxygen. And we are juggling her 2 or 3 medicines and we are trying even harder to improve her condition. So speaking technically, we started her on dual therapy. We started her on medicine to improve her heart function. We kept her on a medicine to decrease the swelling in her body. The dual therapy implies we use 2 drugs for her lung high pressure or pulmonary hypertension. We have now recently added the 3rd drug which has become available, and we hope gradually we increase the dose, she will even do better. So friends, what I'd like to tell you is Child Heart Foundation is helping even those who have been refused help everywhere else. Even when there is no hope, we try to work towards giving families some hope. And here is a child whom almost anybody and everybody would have said stands no chance of improving or surviving, is now 2.5, 3 years into the treatment, and she is doing well. We have told and explained to the family, this is not a treatable condition. This is not a condition where we can reverse everything, but whatever quality of life she will have, we can make it better. It is my plea to all of you to understand that pulmonary hypertension patients do better with medicines. Medicines, if they are expensive, Child Heart Foundation has a commitment to improving the life of these patients by giving them free or low-cost medicines. Please send these patients to us so that we can help them. First of all, with a diagnosis, accurate diagnosis, very important, followed by continuous take of medicines and regular follow-up. All of this we do without charging them anything at all. Child Heart Foundation has done a tremendous job and made a commitment of almost 30 lakhs a year to take care of these patients. On this World Pulmonary Hypertension Day, I request you all to support Child Heart Foundation so that we can support more children. Thank you and God bless all of you.